करता है, हार्मोन प्रोड्यूस है. सो वी हैव समथिंग कॉल्ड हाइपोथायरॉयडिज्म, तो सब स्लो हो जाता है. एंड जब वो ज्यादा प्रोड्यूस करता है तो इट बिकम्स हाइपरथायरॉयडिज्म, वो ज्यादा हो जाता है. सो जब हाइपोथायरॉयडिज्म, जब कम थायरॉक्सिन हार्मोन प्रोड्यूस होता है, तो हमारे हेयर, मैं पहले हेयर की बात करूंगी क्योंकि हेयर का प्रॉब्लम आजकल बहुत है. एंड all of it of course may not be because of the thyroid, but हाइपोथायरॉयडिज्म में क्या होता है, आपके बाल एक तो गिरते हैं, एक्सेसिव हेयर फॉल होता है ऑल ओवर, उसको कहते हैं डिफ्यूज हेयर लॉस, और वो टीलोजन इफ्लूवियम कहते हैं. तो पूरा हेयर लॉस, क्वाइट अ फ्यू हेयर लॉस होता है. एंड आपके बाल जो है ना पतले हो जाते हैं और टूटते हैं ज्यादा. सो दिस इज ऑफ द स्कैल्प. एंड ऑल्सो क्या होता है, पूरे बॉडी में भी आपके हेयर कम हो जाते हैं. तो वो तो नोटिसेबल इतना नहीं होता है, एक तो आपके बाल गिरते हैं, और मेन अनदर साइन होता है आपके आईब्राउज के बाहर के पार्ट, लैटरल 1/3 आपका हेयर फॉल होता है, आईब्राउज के बाल जड़ते हैं, और उसको हम मेडरोसिस कहते हैं. और ये दीज आर वेरी वेरी फ्यू डिजीजेस वेयर वी गेट दिस. So this is one of the quite a characteristic sign of hypothyroidism. तो ये हो गया बालों का. और अभी दूसरा मैं आपको स्किन का भी कहूंगी. स्किन में द स्किन बिकम्स ड्राई, कोल्ड, कूल, ड्राई, रफ. आपको लगेगा कि अभी मुझे बहुत इचिंग हो रहा है. ये फेस की स्किन भी बहुत ड्राई होती है, आपके बॉडी की स्किन भी बहुत ड्राई हो जाती है, और वो क्रैक होती है. सो वी कॉल इट लाइक एन एक्जिमा क्रैकल. तो वो क्रैक होती है, और आपको खुजली बहुत ज्यादा आती होगी, और ये सडनली होता है. देयर इज समथिंग, पीपल आर बोर्न विद ड्राई स्किन. ये आपको होगा जब आपका थायराइड हाइपोथायरॉइड होगा, जब कम थायरॉक्सिन रिलीज होता है तो इचिंग ज्यादा होती है. इसमें हाइपोथायरॉइड में पसीना कम आता है, ऑयल प्रोडक्शन आपके बॉडी में कम होता है, और आपके जो पाम्स और सोल होते हैं वो स्किन थिक हो जाती है. ऑल्सो आपके स्किन में और प्रीडोमिनेंटली हाथों में एक येलोइश ऑरेंजिश कलर हो सकता है. ये सब जब ज्यादा होते जाता है, सो ये सब होता है. आपकी स्किन, इवन इन द आईज, इट कैन बिकम स्लाइटली येलोइश. एंड स्वेलिंग ऑफ द फेस, स्वेलिंग एंड पफीनेस ऑफ द आईज हो सकती है. ये वाटर रिटेंशन नहीं है. वाटर रिटेंशन वो अलग होता है. ये एक दूसरा एक कनेक्टिव टिश्यू, एक हाइलुरोनिक एसिड डिपॉजिट ज्यादा हो जाता है हाइपोथायरॉइडिज्म के लिए. और प्लस आपके शिन्स, शिन्स जो आपके लोअर लेग्स है ना, उधर भी एक स्किन जरा ज्यादा जमा हो जाती है, और वो थिक स्किन हो जाती है. उसको हम कहते हैं प्रीटिबियल मिक्सिडीमा. सो दीज आर द साइन. प्लस नेल्स आपके पतले हो जाते हैं और जल्दी टूटते हैं, और एक और वर्टिकल लाइंस फॉर्म हो जाते हैं. एंड दीज आर द ऑल द साइंस. एंड रिमेंबर दैट skin, the signs on the skin and the hair are almost the first to appear in hypothyroid. So do not attention to all this and do not neglect it. अभी hyperthyroidism में क्या होता है, आपकी स्किन गर्म होती है, वहां ब्लड ज्यादा होता है, तो गर्म होती है तो स्किन बिकम्स फील्स वार्म, स्मूथ, और पसीना ज्यादा आता है, और आपका फेस स्किन लाल हो जाती है, पाम्स भी लाल हो जाते हैं. ये आपको हो सकता है. और आईज जरा बल्ज होने लगते हैं. एंड ऑफ कोर्स बालों में योर हेयर बिकम्स थिन एंड इट बिकम्स स्मूथ, बट वो टूटता जल्दी है, और बालों में भी हेयर फॉल होता है. सो दिस इज इन हाइपरथायरॉयडिज्म. और आपके नेल्स में भी द नेल्स कैन जस्ट स्प्लिट, और वो ऊपर आ जाते हैं. एंड द नेल्स ऑल्सो कैन शो these changes in hyperthyroidism. तो ये सब जो चेंजेस होंगे, प्लीज आप आइडेंटिफाई कीजिए, और पहले आप जल्दी आइडेंटिफिकेशन के लिए डॉक्टर के पास आइए.
Thank you, ma'am. So my next question is to Dr. Madhurya. So in our clinic, we see many patients, like ma'am rightly said, with hypothyroidism or hyperthyroidism,
Yeah.
who have all these classic signs. But we also come across patients with well-treated hypothyroidism or well-treated hyperthyroidism, where they are on optimal treatment and their thyroid function tests are normal, but still they continue to experience hair loss. So what tests would you advise in these patients apart from the thyroid profile?
All right. So, as a dermatologist, if I do come across patients with, skin or hair manifestations which may be suggestive of, thyroid abnormalities, firstly, thyroid profile would be my first go if I'm thinking of any thyroid abnormalities. And if the thyroid, if there is any thyroid abnormality and it is appropriately treated, like it is sufficiently treated, I would like to also consider few other tests, okay, which may be causing the problem. For example, as ma'am said, patients overtly present with, diffuse hair fall, also what we call telogen effluvium. So in such cases, the patient may also be deficient in some nutrients, micronutrients. So I would definitely send for serum ferritin, serum vitamin D3, and serum B12. So these are all the vitamins which are essential for normal hair growth and to prevent hair loss as well. So apart from this, maybe even if patients who are not very affordable, maybe a basic peripheral smear will be suggestive of any iron deficiency. So maybe that. And there are also other skin conditions which are associated with thyroid abnormalities. It could be urticaria, vitiligo. So these conditions may require other blood investigations like serum Ig, which is a component which is generally elevated in cases of urticaria. Along with that, probably allergy testing if any present. So even if there's a patient is sufficiently treated with good antihistamines, along with the thyroid profile is now normal, we may have to go for these additional tests as well.
Yes, so just to summarize, there can be other components to hair loss as well. Like, if somebody has a thyroid disorder, that's not the end of it. And that doesn't mean that the hair fall is only because of
Yes,
the thyroid disorder and
it
other.
should always be a holistic treatment. It cannot be one in one part, where the patient is treated just for thyroid and expect miraculous results from that is not possible. So we need to holistically treat the patient for better outcome.
Especially
I
in
think
our country.
one
Yes, sir.
area which we also need to look into maybe the protein intake, so which we were
Absolutely,
discussing
yes,
earlier.
yes.
So,
Good protein
so
intake.
most of us are vegetarians. So it's almost 50% of Indians are vegetarians, and so the amount of protein which should be there, so that should be in adequate quantity. So if somebody is a vegetarian, at least we need to make sure that they're taking the right amount of milk, which among the vegetable proteins will be providing the best quality of protein, and also maybe pulses and sprouts and all these things should be added to ensure that the protein intake is adequate.
Yes.
Especially in our setting, I
Functional
think.
nutrition is important.
In our setting, anemia is so common. I think you test any other patient for anemia, it just turns out that they have iron deficiency anemia, and also we have a carbohydrate rich diet. So I think anemia and protein intake are some very common things, basics that we should be asking each patient who complains of hair fall, even if they have a thyroid disorder, because as you said, it's a holistic approach. So thank
Yes.
you, Dr. Madhu.
Even vitamin D deficiency is very common, another cause of hair fall,
I think,
and
in fact, in most of the women, I think the first approach should be to take care of the iron and the vitamin D level, and then go for any other, micronutrient supplementation, actually.
right.
Here I'd
So
like to
even
add
yeah,
that here I'd like to
please,
add
please,
that
please.
of course protein deficiency and iron deficiency and vitamin D very common. But nowadays a lot of young men and women, when they go to the gym and they have whey proteins, they have been told by their trainers to have whey proteins, so they have a lot of whey proteins, and whey proteins can cause androgen rise and they can cause hair fall. So I always tell them that look, if you have to supplement, increase, आपका अगर प्रोटीन बढ़ाना है तो आप प्लांट प्रोटीन्स खाइए, और अगर आप नॉन वेज है तो आप चिकन और एग्स और फिश खा सकते हैं, बट डू नॉट टेक वे प्रोटीन्स, यू कैन हैव प्लांट प्रोटीन्स। ये एक है। एंड दूसरा मैं बहुत आजकल देख रही हूँ दैट देयर इज मेनी पीपल हैव फैटी लिवर, so because of the carbohydrate rich diet, they all are getting fatty liver, और वो fatty liver also has a lot of effect on your whole system. लेकिन one piece of advice is that whey proteins आप मत खाइए, because whey proteins, of course जिस लोगों को problem नहीं है आप खा सकते हो, but if you are having hair fall and you are having skin issues, then whey protein अगर आप खा रहे हो तो वो आप बंद कर दीजिए।
True,
Thank
agree.
you. So my next question is to Dr. Saptarshi sir. हमारे पास ऐसे बहुत से patients होते हैं जिनका thyroid profile normal होता है, पर उनका antibody बढ़ा रहता है, anti TPO करते हैं और वो बहुत बड़ा like they interpret it as like it's 1300, it's more than 1300, and they're quite alarmed. So what is your take on this? Can patients with a normal thyroid profile who have antibody positivity have some skin or hair manifestations?
I think it's good that you asked this question. So this actually this brings us to the point why we have the thyroid disorders. So thyroid disorders hota hai because of a condition, most of the cases because of a condition called autoimmunity. Autoimmunity में क्या होता है कि your body's immune system is very well balanced. So अगर body में कोई बाहर से foreign protein आपके body के अंदर जा रहा है, maybe you get a mismatch blood transfusion, the body will react immediately. If somebody has an organ transplant, we need to give a lot of immunosuppressants to make sure that the organ is actually being taken in and not being rejected because of the immune response. So autoimmunity is normally a preventive. The immunity is normally a preventive way to protect your body from foreign proteins. A problem क्या होता है कि किसी में the immune balance is deranged. There might be a genetic component to it कि अच्छा किसी को genetically thyroid, family में भी thyroid है, mother को thyroid है, sister को thyroid है, and that partly that autoimmunity is genetically transmitted. Autoimmunity में क्या होता है, आपके body के खुद के organ ही body as identifies as a foreign substance and they destroy it. So if they identify the thyroid as a foreign substance, they may launch an immune attack against the thyroid and the thyroid gland gets destroyed. So that is the most common reason we have thyroid. Obviously, if somebody gets a surgical removal of thyroid or some radiation, so these things obviously will destroy the thyroid, but 80 to 90% of thyroid will be because of autoimmune disorders. Thyroid is primarily autoimmune disorders जो clinical practice में हम लोग देखते, and many of the skin conditions are also autoimmune disorders. So there are some autoimmune skin conditions, there are autoimmune hair conditions. Dr. Bindu and Dr. Madhavya were discussing those earlier. So some of the names came up. So these autoimmune disorders, they tend to club together. अगर किसी को एक autoimmune disease है, तो एक दूसरा autoimmune disease होने का भी tendency हो जाता है. जैसे vitiligo is an autoimmune disease. Thyroid is an autoimmune disease. Even some of the hair falls are also autoimmune condition. So obviously, if somebody has an autoimmune condition, like say if the antibody is positive, even though somebody is not having overt thyroid, hypothyroid or hyperthyroid at that particular point, so it signifies two things. One, that person has a future tendency to develop hypothyroidism and sometimes maybe hyperthyroidism also, and that person will have a tendency for other autoimmune disorders including certain dermatological disorders, which I'm sure Dr. Madhurya and Dr. Bindu will be elaborating during the next few minutes.
Thank you, sir. Dr. Bindu, now we have spoken about how having a thyroid disorder can have many skin manifestations. How about we look at the other way around? Are there any skin manifestations where thyroid disorders can be more common? And if we treat these thyroid disorders, is it going to make the skin condition better?
See, there are some skin disorders जहाँ thyroid हो सकता है, and one is vitiligo, that is leukoderma, the what the public call leukoderma, white spots सब जगह जो आते हैं leukoderma. The medical terminology is vitiligo. तो जो लोगों को vitiligo होता है उनको थायराइड भी हो सकता है. सो द डॉक्टर विल चेक यू फॉर थायराइड ऑल्सो. दैट इज वन. द सेकेंड इज मेलाज्मा. एक मेलाज्मा एक कंडीशन है, हाइपर पिगमेंटेशन. दैट मीन्स आपको पिगमेंटेशन ज्यादा होता है आपके चीक्स पर, नोज, फोरहेड एंड ऑफ कोर्स ऑन द अपर लिप एंड चिन. ये ऑफ कोर्स और भी टाइम आ सकता है, प्रेगनेंसी में आ सकता है, एंड समवन हु इज ऑन बर्थ कंट्रोल पिल. बट मेलाज्मा अगर हुआ तो हम पहले ही सोचते हैं कि उसका थायराइड करना चाहिए, बिकॉज कॉमन वन ऑफ द कॉमनेस्ट रीजंस इज के थायराइड के वजह से ये आ सकता है. तीसरा है वी हैव लाइक पैचेस ऑफ हेयर लॉस. ऐसा कॉइन शेप पैचेस आपके होंगे स्कैल्प पर, वो बाल वहां से सडनली चले जाते हैं, और कॉइन पैचेस हियर हियर एनी ऑन द स्कैल्प, ऑन द बॉडी, कहाँ भी हो सकते हैं. So that is alopecia areata, and of course alopecia areata patches जब localized patches होते हैं, अगर ये alopecia totalis means पूरा भी जा सकता है, and or all over the body we call it alopecia universalis. तो वो भी हो सकता है because with the thyroid together with it. And then of course we have अर्ली ग्रेइंग ऑफ हेयर. किसको आजकल बहुत बच्चे 15 बरस में आते हैं, माँ लेके आती है, कहती है डॉक्टर उसके बाल सफेद हो गए हैं. ऑफ कोर्स वन कॉज इज हेरिडिटरी, दूसरा कॉज हो सकता है कि थायराइड की वजह से, तो ये भी हो सकता है. देन पर्निशियस एनीमिया, आपको B12 डेफिशिएंसी होगा, तो ये कॉमनेस्ट हो सकता है. ओके ना, अगर समझो विटिलाइगो है या एलोपेशिया एरियाटा है या मेलाज्मा है, तो थायराइड निकला, तो थायराइड ट्रीट करने के बगैर दिस कंडीशन विल नॉट गेट बेटर. विटिलाइगो के लिए, ल्यूकोडर्मा के लिए आपको ट्रीटमेंट करना ही पड़ेगा, प्लस एडिशनल आपके डॉक्टर आपके थायराइड को भी ट्रीटमेंट करेंगे. अगर नहीं किया तो आपका ये विटिलाइगो या मेलाज्मा टोटली ट्रीट नहीं होगा. बोथ will have to be treated accordingly, simultaneously, तो ही हमें results मिलेंगे.
Thank you, ma'am. So, Dr. Madhurya, most of patients with thyroid disorders or complaining of hair fall are usually women. So we tend to see more women because of the hair fall or skin conditions. But what is the incidence in men? Do these conditions tend to affect men as well?
Definitely, like you rightly said, these conditions more commonly seen in female gender than in male gender. Okay, so in female gender, the chances of hypothyroidism is more common, especially in older women and women in postmenopausal age group. So it probably we can attribute it to the sex hormones in the female gender, so which are leads to this hypothyroidism. And also in women in childbearing age group, like during pregnancy or even during postpartum period, they tend to develop something like sir said called autoimmune thyroid disease. So these autoimmune thyroid conditions is common during pregnancy, as well as they tend to persist even postpartum period. So on the whole, thyroid abnormalities is more common in women than in men. But as far as skin conditions is concerned, the manifestation will pretty much be the same. It's just that women tend to come to your clinic more, for, it could be facial pigmentation, generalized pigmentation of the body, like of the arms, neck, back of the neck, thickening of skin. So all of these, women tend to come to, in clinic. So that's probably why we see these cutaneous manifestations more commonly in our clinic in women. So, but manifestations as such will remain the same in either of them.
So, just out of curiosity, how many men do you see with these disorders? Like,
With
if you take
generalized hair fall most commonly in seen in women and men, but men tend to come mostly for the pigmentation, periorbital pigmentation usually, as well as the pigmentation of the neck. They tend to come to the clinic.
But
right.
now I'm seeing a lot of more men also coming with hair fall and
Yes, hair fall is the most
a
common,
lot
probably
more
equal in both women
hair
and men.
fall and
But
maybe
nowadays, it's
even,
probably men pigmentation. Now they're
yeah, they
starting
are
to
coming.
come for it. Yeah.
Yeah,
My
yeah, they
next
are
question
coming
is
more often. Yeah,
right.
we do see them more often.
My next question is for Dr. Saptarshi. So we have spoken about how the thyroid affects the skin and hair and nails. We've spoken about how disorders of skin can have thyroid underlying thyroid disorders. So to talk about medicines, so if like say Dr. Madhurya or Dr. Bindu is using any medicine for a dermatological condition, can it affect the thyroid levels?
So I think it's most of the. So we are discussing about vitamins, right? Micronutrients. So one of the so most of the vitamins don't affect thyroid levels, but some of the vitamins actually affect the thyroid testing. So a very common out of that is biotin. So most of the hair supplements, if you go through the level, उसमें biotin होता ही होता है. So and you actually need to be very very careful if you are taking biotin as a hair supplement, if when as an oral hair supplement, if you are going for your thyroid testing. So biotin does not actually alter the thyroid functioning, but what it does, it interferes with the testing. So if you are on a reasonable dose of biotin and you go a testing for thyroid function test, the T3 and T4, it can be a total one or a free one. So they tend to actually go up, and the TSH falsely tends to go down. So a very important precaution to all our everybody who is on thyroid medication and oral hair supplements containing biotin, that you need to stop your biotin supplements at least for 40 to 72 hours and then only undergo your thyroid testing. So another area where we actually need to be careful is if somebody is taking a multivitamin supplement, it has got calcium or iron. So that actually causes significant disturbance in absorption of thyroid. So thyroid is a very, it's otherwise a very stable hormone, but thyroid is a very sensitive hormone as far as the absorption is concerned. So you have to take it early morning, empty stomach. You need to give a gap of at least 30 minutes, preferably 1 hour after after taking other than water, anything, any other food should be avoided or drink should be avoided for at least 30 minutes, preferably 1 hour. And if somebody is on calcium, iron or other vitamin supplements, that gap should be at least 4 to 5 hours. So you take your thyroid and you do not pay attention and you have your breakfast, then pop in a tablet of calcium and iron. So most probably thyroid is not going to get absorbed properly. So these are so vitamins won't per se affect the thyroid. So there are lots of hypotheses that this can affect thyroid, that can affect thyroid. Again, thyroid in Indian diet, like cruciferous, whatever quantity we take in, it hardly can affect the thyroid. So unless somebody is taking it as a staple food, which some of the African tribes do, and that is from where that concept has come in. So most of the foods won't, but obviously most of the vitamins also won't affect thyroid. But biotin, be careful when you are undergoing testing. And for iron, calcium and vitamin supplements, just ensure the right gap between taking a thyroid tablet and taking the supplement. Maybe shift it to after lunch or after dinner. That should serve the purpose.
Thank you, sir.
I'd like
I
to
want
add here, I'd like to add here, Dr. Saptarshi, this is very interesting. First of all, there are many patients who say, Doctor, I am taking biotin 1000 micrograms. My friend is taking, her hair fall improved, so I am taking it. So I'm so glad that you're telling them outright over here, please stop. That is one. And secondly, even this taking the thyroid pill, the thyroxine pill in the morning, There was one patient who used to take the thyroid pill in the morning, but with that she used to take Pantodac because she used to
Same.
feel that I take my acidity pill, तो उसके साथ में thyroid tablet के साथ में वो Pantodac ले रही थी, तो with the result उसका thyroid tablet absorb ही नहीं हो रहा था, and all her thyroid levels went wrong till she was questioned कि आप क्या क्या ले रहे हो, you have to take it on an empty stomach. हाँ, मैं empty stomach में ले रही थी, लेकिन उसके साथ में मैं Pantodac ले रही थी. So this also they have to be told. So you rightly brought this out to them कि वो ही tablet खाना है और कुछ नहीं खाना है.
And I think
And
also nowadays dermatologists have also become more careful. We don't try to, give biotin more than 10 milligram. Probably give it for a very brief period of time, because it's probably too much. It's not very useful for hair growth as well.
so right. And taking Dr. Bindu's cue, so I had one such patient where I was not able to explain why the TSH is not getting controlled. So ultimately, it came out that the person used to keep it in the kitchen, so, and just above the oven, and it was the heat which was causing the thyroid tablet to get degraded. So it was not working. And so we asked, where are you keeping? So we asked 10 other questions. Then ultimately, that was the answer.
Oh, this is a valid point. I must tell my patients.
Many of them are in the habit, okay, chai banana hai, kitchen, chai banate
Yes, yes,
thyroid
yes.
tablet
Kitchen में
and
रख
then
दो.
it's kept in
Okay, the
kitchen
heat
mein
will
rakh do.
degrade it. Oh
Right.
yes, yes. Very valid point. Yeah, yeah.
Yes.
Dr. Bindu, going to the next question, आजकल Instagram और Twitter और सारे social media पे सब कुछ dermatologist है या endocrinologist है. So they are talking about skin practices, or they are talking about ways to lose weight, or ways to reverse diabetes, or all such things. So I would say every other person on all these social media is either a dermatologist or an endocrinologist. So to ask the dermatologist, what are the recommended skincare, hair care, and nail care practices that patients with thyroid disorders should be following?
Dr. Lakshmi, you very aptly said that they all think that they are the dermatologists or endocrinologists. Patients come and tell me, doctor, I have this is the diagnosis. So I tell them, why have you come to me? And today, in fact, one of the patients said, but Google said like this. So I said, if by reading Google you become a doctor, then we'll become redundant, or I will start reading and I'll become an engineer, or I'll become a NASA scientist. Everything is there on Google. So this is a fallacy. This is a problem which we all are facing. And I know, but still we have to do what we have to do is educate them. So I would like to say over here is that now everything is there out there on the net. So when patients come with say hair care, let me talk about hair care क्योंकि वो बहुत common है. तो many people say कि डॉक्टर मैं न्यूयॉर्क गई थी तो मेरे बाल गिरने शुरू हो गए क्योंकि उधर का पानी खराब है. मैं दुबई रहने को गई तो मेरा बाल गिरने शुरू हो गए, सेम दुबई में पानी बहुत खराब है. सो देन आई टेल देम, ऐसा होता तो हर कोई दुबई में बॉल्ड होता या हर कोई न्यूयॉर्क में बॉल्ड होता. इट इज नॉट द वाटर, it has to do with an internal problem. आपकी skin और hair और nail is only a reflection of your inside. तो बालों के लिए one of the commonest causes, there are many people who have come with hair fall, and when we do the thyroid, and so many thyroid abnormalities I've detected, because I believe holistic treatment is the best. तो हम जब अगर आपका टेस्ट करते हैं और अगर थायराइड निकला, आपके बाल ड्राई है, फ्रिजी है, ब्रिटल है, टूटते हैं, तो अगर थायराइड निकला तो पहले आप थायराइड की गोली आपका एंडोक्राइनोलॉजिस्ट आपको देगा. तब वो आप एंडोक्राइनोलॉजिस्ट देगा या देगी, सॉरी डॉक्टर लक्ष्मी, तब आप दवाइयाँ बालों के लिए दवाइयाँ शुरू कर सकते हैं. तो हम शुरू करते हैं क्योंकि कॉमनेस्ट कॉज जब पहले हमने कहा था iron deficiency, protein deficiency, zinc deficiency and micronutrients. हमको micronutrients की भी deficiency होती है. As we grow older, तो हमारे absorption capacity decrease हो जाती है. Number one. Number two, क्या होता है आजकल? I want to give one example. B12 हमको कहते थे कि हम खाली एनिमल सोर्सेज में होता था. So I'm a vegetarian, so I used to feel that okay with milk and other things I'm getting. लेकिन अभी मिल्क ऑल्सो काउस को हॉर्मोन्स देते हैं, तो मैं तो कहती हूँ मिल्क भी कम करो. और क्या होता है, सॉइल में जो मैन्योर डालते थे जिससे हमको B12 मिलता था वेजिटेरियंस को, अभी वो केमिकल्स डालते हैं, तो प्लांट्स में भी B12 नहीं है. तो इसीलिए हमको भी B12 डेफिशिएंसी हो सकती है. वेजिटेरियंस, मैं वेजिटेरियंस की बात कर रही हूँ. तो इसीलिए दवाइयां खानी पड़ती है क्योंकि B12 डेफिशिएंसी हो सकती है. आयरन, जिंक, प्रोटीन्स ये आपको दे जाएंगे. मल्टीविटामिन्स भी दे जाएंगे फॉर हेयर, बिकॉज इवन माइक्रोन्यूट्रिएंट्स लाइक सेलेनियम, बायोटिन भी थोड़ा देना चाहिए. ऑल दीज थिंग्स आर copper, all these things are required for the adequate nutrition and growth of your hair. और एडिशनली हम ऑफ कोर्स मिनॉक्सिडिल देते हैं, सब दवाइयां देते हैं टू स्पीड अप द ग्रोथ ऑफ द हेयर. ये हो गया आपके बालों का. अभी स्किन, हाइपोथायरॉइडिज्म में स्किन आपकी बहुत ड्राई हो जाती है एंड मेनी पीपल विद इचिंग. क्योंकि बिकॉज आपका स्वेट प्रोडक्शन भी कम होता है, ऑयल प्रोडक्शन भी कम होता है. सो द एडवाइस आई गिव टू एवरीवन हु हैज दिस ड्राई स्किन एंड हाइपोथायरॉइड इज आप बात लेना चाहिए विथ ल्यूकवार्म वाटर. गर्म पानी नहीं करना. लोगों को बहुत आदत है बहुत गर्म पानी करना, वो मत करना. ल्यूकवार्म वाटर कीजिए एंड पैट योर स्किन ड्राई. जोर जोर से रब मत करना, थोड़ा मॉइस्चर रहने दो. वहां मॉइस्चर जब रहेगा एंड विद इन मिनट्स आप एक थिक मॉइस्चराइजिंग क्रीम या इवन पेट्रोलियम जेली आप एक थिक लेयर लगा सकते हो. वो आप थिक लेयर लगाओगे तो वो मॉइस्चराइजर अंदर नहीं जाता है. मॉइस्चराइजर और स्किन के बीच में जो आपका लेयर ऑफ मॉइस्चर था, जो वाटर था, वो अंदर जाता है. सो दिस इज द वे यू विल मॉइस्चराइज योर स्किन. और सोप भी आप यूज करोगे, यूज सोपलेस क्लेंजर्स. कोई जरूर नहीं है कि आपको हार्श सोप यूज करना चाहिए, उसकी भी जरूरत नहीं है अनलेस यू आर अ 15-year-old प्लेइंग फुटबॉल एंड यू आर इन द मड. जब आप अडल्ट हो, आप एनीवे ज्यादा इतना स्किन पे गंदगी भी नहीं होती है, so you can just use soapless cleansers and only in the folds you can use soap every day. Other days you can use even once a week. Lukewarm water, pat your skin dry, don't rub. Within 3 minutes apply a layer of moisturizer and you can apply moisturizer twice a day. ये आप 2 बार भी कर सकते हो. और आपकी स्किन अगर बहुत ड्राई है, जरूरी नहीं है कि आप 2 टाइम नहाओ. Once a day is good enough. And nails, try and not use sanitizer 20 times. Do not wash your hands 20 times with soap. 1 या 2 टाइम is enough. क्योंकि ये आपके नेल्स ऑलरेडी ब्रिटल है और ज्यादा ब्रिटल हो जाएंगे. अब ये सब फॉलो करो तो आपको स्किन, हेयर और नेल्स बहुत अच्छे होंगे. एंड टुगेदर विद दैट आप अपना थायराइड पिल्स लोगे, एंडोक्राइनोलॉजिस्ट के पास जाके रेगुलरली दवाई लोगे और ये करोगे तो यू विल बी फाइन.
Thank you, Bob. One more question I had.
Also, they can also, doctor, they can also limit their bath time to less than probably 5 to 7 minutes. So that also helps, because even if it's lukewarm water, but they're having bath for, 25-30 minutes, that also leads to, excess moisture loss. So I think that is also one, thing they can follow.
Right. So I have seen a lot of advertisements for gummies for hair fall. So what actually is this? Everyone is talking about.
I keep telling my patients this funny thing, the only thing it will lead to is your, spike in sugar level, because these gummies are loaded with that. So
they are full of sugar.
Yes, full of sugar. That's the only thing it leads to a rise in your sugar level.
Now the pharmaceutical companies and the other companies, they have to do what they have to do, but it's our place to guide them rightly and tell them that's only sugar.
Absolutely.
Right, those ads are all over the internet now. Gummies
Yes.
for
And
Unfortunately,
there are
yeah.
phases. There are phases of collagen powders, gummies. These are all in. Biotin was in. Now of course it is going down, but these are all waves. ये waves आते हैं जाते हैं, पर आप प्लीज अपने डॉक्टर से पूछिए और वो ही कीजिए जो आपका डॉक्टर रेकमेंड करता है. थायराइड है तो एंडोक्राइनोलॉजिस्ट ही आपको राइट एडवाइस देंगे.
Thank you, ma'am.
Yes.
So, many patients who have thyroid disorders, they are very anxious about their hair fall. And once we start treating, say, their hypothyroidism, we expect the thyroid levels to be normalized by 6 weeks or 2 months at max. But still, their hair fall keeps continuing, and they're very anxious. Doctor, ye kab theek hoga? Kab theek hoga? So, what is the average duration that one would expect that are you after you treat a thyroid disorder, that if the hair fall, say we don't have any other causes for hair loss, concomitant causes for hair loss, and when should it be okay once we start treating?
So I generally tell them that agar for hair fall, if you have got a thyroid problem today, if your thyroid hypothyroid आपका शुरू हुआ है आज, आपका हेयर फॉल शुरू होगा 2 months लेटर. कल आपका हेयर फॉल शुरू नहीं होगा. इट हैज टू बी 2 months लेटर. आपके जड़ों को न्यूट्रिशन कम मिलेगा, थायराइड हार्मोन कम मिलेगा, सब चीज कम मिलेगी. सो बाय द टाइम इट मैनिफेस्ट, इट्स ऑलवेज 2 to 3 months लेटर. तो जब आपका डिटेक्ट हुआ थायराइड और आपने आपने थायराइड दवाइयां शुरू की, एंड एट द सेम टाइम आपने अपने से ट्रीटमेंट्स किया, आपने विटामिन भी शुरू किए, ये सब आपके लिए आपके डर्मेटोलॉजिस्ट ने शुरू किया, तो आपको इफेक्ट दिखने में मिनिमम 3 months तो लगेंगे ही.
Because you also need to take care of your hair cycle. It takes so long for your hair to grow back, and first your hair fall needs to stop. So that is generally taken care of with your thyroid medications with the right dosage. The hair fall tends to stop sooner, probably within the first 8 weeks. But for your hair to start growing back, the magic number would be 3 months or 12 weeks.
I also tell them, educate them a little bit, that hair grows at the rate of 1 centimeter per month. So you can imagine how long they feel, doctor, मेरे बाल ऐसे thick हो जाएंगे अभी. So I tell them that will take 1 year, 2 years. It will start growing here. So if it's 1 centimeter per month, so then you can imagine how long it will take. As Dr. Madhurya rightly said, that initially they will notice a decrease in the hair fall. That is the first stage they will see. So then they, it's a lot of hand holding. So आपको पेशेंट होना चाहिए. सो आई टेल देम, आपके घर में अगर झाड़ है तो झाड़ भी सूखने को आप पानी आज कम डालोगे, 8 दिन कम डालोगे, कल वो सूखेगा नहीं, उसको सूखने में भी टाइम लगता है. सिमिलरली जो रूट्स को नरिशमेंट नहीं मिलती है, तो बाय द टाइम आपके बाल में इफेक्ट दिखेगा, वो टाइम लगेगा और इम्प्रूवमेंट के लिए भी टाइम लगेगा. सो दैट पेशेंट.
Also, I think other skin conditions, could be pigmentation or melasma, like ma'am told, they generally take a longer time to, respond, because even though you're supplementing with thyroid, which is the right thing to do, they will require additional, management. Could be in the form of, right topical medication, depigmenting creams, sunscreen, good moisturizers. But I think the skin, condition like xerosis or, the dryness in skin tends to recover faster after starting thyroid medication, probably within the first, 2 to 3 weeks itself.
Yeah, but this they have to follow. It's like the routine about using the soapless cleansers and applying
Absolutely.
moisturizer.
Yes.
Because
Only with the right management and starting the medication.
This can continue, and if they have melasma, you may correct the thyroid, but for the melasma to go, it
Yes.
takes quite a long time. And of course, I don't want to go through all our treatments, but if they have melasma, अगर आपको पिगमेंटेशन है तो आपको सनस्क्रीन जरूरी लगाना है, चाहे वो बरसात हो, चाहे आप इंडोर्स हो. आप इंडोर्स होगे तो आप हमेशा, आजकल वर्क फ्रॉम होम, आप एटलीस्ट 8 घंटे आप अपने लैपटॉप के आगे हो. द लैपटॉप्स एमिट ब्लू लाइट. ब्लू लाइट आपकी पिगमेंटेशन और बढ़ाती है. तो घर में भी हो, या आप कुकिंग कर रहे हो, या आप बाहर जा रहे हो, सनस्क्रीन लगाना ही है. मैं लोगों को कहती हूँ कपड़े मत पहनो पर सनस्क्रीन लगाओ,
और बार बार लगाओ.
बार बार लगाओ. एवरी 3 आवर्स लगाते रहो, क्योंकि वो सनस्क्रीन भी एक परमानेंट शील्ड नहीं है. आप चाहे स्वेट प्रूफ भी लगाओगे, वो 3 घंटे के बाद आना ही है. 9 बजे, 12 बजे, 3 बजे. आई राइट इट ऑन माई प्रिस्क्रिप्शन. आप
Yes.
लगाओ तो ही आपको कुछ फायदा होगा.
Right. So before we end the session, I would request a short takeaway messages from all of you, starting with Saptarshi sir.
First of all, I would like to thank all the panelists, Dr. Madhurya, Dr. Bindu, Dr. Lakshmi also did a wonderful job. I think you need to include me in the next session also if you have one. I learned so many new things today about skin and hair. I think nails is the one which takes the longest to
Yes.
recover. So, and coming back to thyroid, I think most of the people, what they tend to do is they try to self-medicate too much with thyroid. अच्छा मेरे TSS नॉर्मल है, मैं थोड़ा डोज कम कर देती हूँ, थोड़ा ये बढ़ा देती हूँ, अच्छा मेरा थोड़ा वेट बढ़ गया तो थोड़ा. So regarding thyroid, it's a very easily treatable disease unless you make it complicated. So my suggestion is, so you need thyroid conditions mostly are treatable, thyroid related problems, and you need to take the medicine in the right way, do a periodic checkup, and get in touch with your doctor before making any changes to your medicine. I think that is important. Since it's a long term disease, you need to follow these basic steps.
Dr. Bindu.
मैं आपको एक एडवाइस आई वुड लाइक टू गिव कि आजकल आई हैव सीन के skin and hair, more than hair, skin, hair fall could be one of the earliest sign of thyroid. मैं इधर एक एग्जांपल दूंगी. आई नो वी आर समर. एक लेडी 1 महीने से वो शी वाज पुटिंग ऑन वेट, शी वाज फीलिंग टायर्ड. उसने सोचा कि नहीं, कुछ नहीं, कुछ नहीं, कुछ नहीं. लेकिन मोमेंट शी गॉट हेयर फॉल, नेक्स्ट डे शी केम टू माय क्लिनिक, and luckily she came, and okay, I suspected thyroid और मैंने टेस्ट किया and she turned out to be thyroid. So यहाँ मैं आपको I would give you all a piece of advice कि स्किन, हेयर एंड नेल्स के चेंजेस तो थोड़े लेट होते हैं. तो स्किन एंड हेयर अगर आपको कुछ कह रहा है तो आप निग्लेक्ट ना करो. हेयर फॉल हो रहा है तो डू नॉट फील कि मैं बायोटिन खा लूंगी, मेरी फ्रेंड ये खा रही है तो मैं ये गोली खा लूंगी, मिनॉक्सिडिल लगा दूंगी, मेरे बाल ठीक हो जाएंगे. और आप वेट करोगे 1 महीना, 2 महीना, 3 महीना. सो टू bring back the hair takes much longer than controlling it before. It's like 10 लाख कमाने में कितना टाइम लगता है, 10 लाख एक्सपेंड करने में 1 मिनट लगता है. यू गो बाय एन एमरल्ड नेकलेस. सेम वे बाल, हेयर कंट्रोल को लाने में बहुत टाइम लगता है. सो इफ यू फील आपको ये जो साइंस है, आप इमीडिएटली आपके डर्मेटोलॉजिस्ट के पास जाइए. इंस्टाग्राम में पढ़ के कुछ सेल्फ मेडिकेट मत कीजिए. और आपका TSH अगर टेस्ट किया है, कुछ भी अप डाउन आया है, आपके एंडोक्राइनोलॉजिस्ट के पास ही जाइए. थैंक यू वेरी मच.
Thank you. Dr. Madhurya.
I think, like Saptarshi sir rightly said, simplify your thyroid medications with the help of your endocrinologist, and be persistent with your skincare treatment with your dermatologist. And patience is key, because it takes time to see results, because it's a endocrine hormone, and also your skin and hair require the time to heal and show results.
Thank you. Before I end, I actually want to tell Dr. Madhurya and Dr. Bindu that me and Dr. Saptashi were thinking that, oh, today we are talking to the dermatologist. We are going to, listen to some glam stuff for hair fall, like, hair treatments or some magic serums or stuff like that. But it's all in the basics, isn't it? Like, take your thyroid
Absolutely.
medications properly, the right nutrition, and correcting the vitamin deficiencies, the non-glamorous stuff that we all do.
At the end of the day, your skin and hair is the reflection of what's happening inside. So that's the most important thing.
Right. So thank you, Dr. Bindu, Dr. Madhurya, and Dr. Saptarshi for joining us on this panel discussion.
Thank
I
you.
had a lot of fun discussing all these issues related to thyroid disorders and skin disorders. I think it's a holistic care by the endocrinologist and the dermatologist, which can lead to optimal outcomes for our patients. Thank you once again.
Absolutely.
Thank
Thank
you.
you,
Thank you.
doctors. It was a
Thyroid
lovely
Society for
session.
inviting
Thank
me.
you.
Thank you.
Thank
Thank
you.
you. Thank
Thank
you.
you. Over to Dr. Amaya.
That was really, really mind blowing. I think the discussion was smooth, extempore, and directly dil se. I express my deepest gratitude to my dear friend Dr. Saptarshi, our
Thank you.
guests Dr. Bindu Sthalekar and Dr. Madhurya, and to make all the experts feel at home and getting the best out of them is also an art. Take a bow, Dr. Lakshmi Nagendra, for doing a wonderful job as a moderator. I must also tell you one thing, that all our audience who have joined today must be, I think, really excited, and let them translate this excitement into seeking help, because many of our population needs help in the thyroid as well as the skin aspects that we discussed, but they are shy. They try alternative therapies. They feel why to go to a doctor, and the most important thing is when a doctor refers them to a second doctor, an endocrinologist referring to a dermatologist, or a dermat to an endocrinologist. Now all of you, my dear audience, must have realized that when a specialist refers to another specialist, it adds maybe value, maybe more different angle of care, which is going to improve your health better. I must also express my gratitude for to the Indian Thyroid Society for making this, I would say, symbiotic sessions possible. Hats off to our president, Dr. Shashank Joshi sir, our ever active coordinator who is usually here. I am deputizing for him, Dr. Mohan T. Shenoy, our secretary, Dr. Arun Menon, and all our audience who have joined for the evening, as well as our technical team. Thank you, one and all, and signing off for the day.
Thank you. Thank you.
Thank
Thank
you.
you.
Thank
Thank
you.
you. Thank you.
In the
Thank you.
end, if you have any questions, do post and the Facebook page on our Twitter handle at Indian Thyroid Society. Do follow us on Facebook and Twitter. And if you want to just ask one-on-one, please feel free to mail us at endocrinewellness@gmail.com. Due to technical reasons, the questions cannot be answered live, but we will make sure that they are addressed in whichever way you post it. Thank you once again.
Thank you.